Well, today I'd like to address a few important issues as we head into the first and I hope the last Thanksgiving and Christmas holiday during the COVID-19 pandemic. As we know, it is here now. It will be here till a vaccine comes along, but we're making progress. We all know that the virus has dramatically affected the lives of virtually everybody in South Carolina, as well as other parts of the country. We've lost friends and loved ones. People have lost their jobs and businesses. Families have been separated from each other, especially from the seniors among us, that is the parents and grandparents. Children's learning progress has suffered, as you know, due to the closed schools, and physical, mental, and emotional health damage has been done through increased alcohol and drug usage and addiction brought on by isolation, stress, depression, and fear. So we've all experienced that, and for many it has been devastating. Right now, families and friends are anxious, rightly so, to visit and get back together and celebrate the holidays. But this year will be different from others. We have to be careful. We have to be smart. I repeat, we have to be careful and we have to be smart so that we can all celebrate again together next year. If your plans include traveling or gathering together indoors for Thanksgiving especially, I'm asking that you do something very important, something that could save lives at Thanksgiving, and that is get tested before turkey. Get tested before turkey. Easy to remember. Any South Carolinian who wants to get tested can get tested in South Carolina and get the results back before Thanksgiving Day, which is next Thursday. Right now we have almost 300 testing sites around the state. Some of them are mobile. They change from day to day and week to week, but you can find them all on the DHEC website or go to Accelerate SC. They are there, and you can get the results generally between 24 and 48 hours. So men and women and children of South Carolina, we have plenty of tests out there for you, plenty of locations. So don't wait. Go ahead and get tested before turkey, and you'll be glad that you did. We all know by now what we must do to limit the spread of this highly contagious virus. You have to wear a mask when social distancing is not possible, especially when you're indoors. Wash your hands routinely and keep washing them all day long. And for those of us that have surfaces in the offices or at home, wipe those surfaces down. Keep them clean, because as you know, this is a highly contagious virus. In addition, I would ask people to do things possibly a little differently this Thanksgiving. Gather in smaller groups if you can. If you usually have one big table, maybe have two tables and spread people out a little bit. Space out inside while dining or visiting, or be like the original Thanksgiving and do it outside. If the weather is pretty, do everything you can outside. The more outside we can be, the better we will all be. For people at high risk, like the elderly or those with various underlying conditions, think of something special. Use your imagination. Be smart. Perhaps deliver food to the home with them and stop by just for a short visit and then go. And maybe there are any number of ways that we can accomplish the task in those very dangerous situations of being together but not being at risk. Limit the number of family or friends going shopping together and in the stores. There are a lot of us that do shopping online. You don't get the virus online, so consider doing shopping that way. Take short trips in the car. Don't go take long trips. Take short trips and keep a window open if you can, and also, depending on the size of the car, don't fill up the car with people and go on a long trip. That's an invitation for that virus to spread. And again, stay outside, get outside as much as possible if the weather permits, because that fresh air is not what the virus likes. So if it's again, if it's been beautiful, the weather's been beautiful here. If it stays like this would be a good Thanksgiving, to do things on the back porch, to do things in the yard, do things a little bit different than we had before, and we'll have a happy Christmas and a happy Thanksgiving next year. For many South Carolina families, schools provide the only opportunity that parents have to go to work. Most parents who work can't stay home with their children every day. They must go to work in order to pay the bills, keep the roof over their head. Parents should not have to choose between their child's welfare, or their job. School closings have disrupted children's learning progress, placing their skill development behind schedule and requiring remedial instruction. We all know that the best way for children to learn is to have a teacher over their shoulder. In many places, that is not happening now. 15 school districts began this school year by providing parents the option, as I asked, the option of sending their child back to the classroom for 5 days a week, in-person instruction. A number of school districts have since announced a similar return to the classroom. At my direction, the Department of Administration purchased $10 million plus of personal protective equipment for every school district that requested it. We have plenty of protective equipment available for any school district that needs it. In order to keep those classrooms open and to allow more to reopen, today we are announcing additional action. In the coming days, I will be issuing an executive order directing the Department of Health and Environmental Control to provide every school district with COVID-19 testing kits so that students, teachers, and staff can be tested on a regular basis in every school. We'll have plenty of the kits. It will be up to every parent, up to the parents to decide if they want their child to be tested. A completed parental consent form will be required before any child can be tested. If you want your child to be tested, you need to sign the form and send it in. If you don't, just say so. Dr. Traxler will go into more detail on that in a moment. By following official COVID-19 procedures and protocols, schools can be operated safely. There are many in our state now that are following the rules, and they're operating perfectly safely. We want all the schools to be open and to operate safely. In the same way, many businesses and many manufacturers, large and small businesses, restaurants, merchants, and state government have all reopened. The schools have to reopen. They are central to the progress, not only in education, but also the social development and the emotional health of the children, as we know. For every one of these closures, every action, every restriction, there are consequences, and we have to be mindful of that. So we want those schools to open, and those tests will be available. Call on Dr. Traxler, please.
Thank you, Governor McMaster, and good afternoon. So DHEC will be providing test kits to the public schools in South Carolina through the Department of Education. These will be the Binex Now rapid antigen tests that are made by Abbott and have been provided to South Carolina from the federal government. We will be issuing a standing order authorizing the school nurses to be trained in how to collect the specimen and how to perform the tests. Again, assuming the parents or guardians have provided written consent or verbal, depending on the situation, to the nurse. The first rounds or so of these will be aimed at use for symptomatic students and staff. So those who may become ill while at school, we also will let them potentially do some testing, almost drive-through like in the parking lot if the child, we certainly don't want them sending the child to school sick. But this is really to during the cold and flu season allow us to rule out COVID-19 more easily. In these children, especially ones we're getting to normal testing sites, might be more of a challenge. And this will allow the students to stay in school if they are negative, and of course don't have another condition such as the flu, and therefore reduce the amount of time that students are missing from school. Again, this will be voluntary for the parents and guardians. They can choose to have their child tested or not, and the nurses will be trained. This is just inside the nose. It's the real shallow nasal swab, so they will be trained in that and how to perform the test on the cards, the Binex Now cards, and then they will be, of course, reporting the results to DHEC for both positives and negatives. And we will do appropriate contact tracing and case investigation as needed for any positive results. Thank you.
Thank you, ma'am. Are there any questions?
Yes. So when are these tests going out? How many is each school going to get? What are the logistics?
So our goal is to have these for the week after Thanksgiving for schools to begin, or at least to begin the process there with each individual school and school district. And the allotment per school, I don't have the numbers in front of me, but are being determined in conjunction with the Department of Education based on the population of students and staff at the schools.
Like enough for every child, or?
We anticipate that it should be enough for all of the symptomatic children whose parents and guardians would want them tested, at least from now going forward. The ongoing availability of tests, we anticipate to remain good, and so hopefully this is something we can continue through the cold and flu season.
And you said these are going to be rapid tests?
Yes, these are about 15 minutes tests.
And, so those tests have been, people who test positive have been considered probable instead of confirmed. Is that still the case?
Yes, that's correct, because these are antigen tests. These are considered probable cases, not confirmed, but they still count in our case counts for probable cases.
Governor, with cases starting to climb in the state, have you put in any thought to bringing back some restrictions or anything like that?
Yes, we have, and we're not going to bring back the restrictions. We want to. In our state, we've done it differently from many others. There were others who went into lockdown, closed businesses, they forced people out of business. Businesses have closed. A lot of those states they're going to have to borrow money. We are not. We've been very careful. The legislature's been very careful. We'll be announcing soon, perhaps tomorrow, unemployment. We think our unemployment rate is going lower and lower, which is good. You remember last count, it was 5.1%. I think New York was 10 or 11, and California was 10 or 11, and of course they've been locked down and are going back into lockdown. We've taken a different course. We've been measured. We've been careful. We followed the science and the practicality, and I believe that the jury is in. We've done better following, being smart and careful about it instead of using a too broad and overbroad approach. And we have stuck with the Constitution of the United States, we believe, which is very important. So we're not going back. We want South Carolina open. We have not closed. We will not close. It's important for business. It's important for people to have jobs so they can support their families and grow. And that's what we're doing.
And
yes,
actually,
ma'am.
There are some school districts that have talked about closing or going all virtual after Thanksgiving, after the holidays, if cases continue to go up. What is your message to those districts?
I would say to think carefully about that, because around the country and around South Carolina, we're doing very well in those schools who have gone to face-to-face 5 days a week. And we know what to do. And we have plenty of personal protective equipment. And now we're getting these rapid tests in where the children and the staff and the teachers can be tested. So we're making great progress in the schools. And I think there are about 50,000 private school students, private, independent, or Christian schools, and they're all on 5 days. I think we have 19 out of 79 or 80 of our districts that are on 5 days, and I think the results have been good. So what we wanted to do at the beginning was let the parents decide if they wanted the children in school or virtual or some combination. And I don't think that the school districts have kept up with the desires of the parents. When it was announced just recently, I think in New York City, that they were going to close the schools in a couple of days, and people are quite upset about it, because the unintended consequences of that are enormous, and sometimes they're permanent. And if there's a smart way to keep the schools open and get the children in school where they desperately need to be, then that's what we need to be trying to do. And that's what we're doing here. Yes, sir, in the back in the dark. Ma'am.
Hey, Governor. So many restaurants are still struggling, even with the economy remaining open, but patio dining has helped tremendously. The Restaurant Association says as it gets colder, people won't want to sit on the patio, and some restaurants could go under. With federal help maybe coming next year, do you anticipate maybe the state can help in any way before the end of the year, so maybe restaurants won't close?
Well, I think that the states can help in.
Could any help come from the states if?
Well,
they
yes.
cannot afford to wait for
Accelerate SC, as you know, has given many recommendations. We know more about the virus than we did. I don't know if we can count on, or what we can count on, or if we can count on help from Washington. But we know the danger involved, and we know how to be careful. We can follow the rules. We can be careful. We may not be as flourishing as much as we want, but we will be flourishing more than they are in other places, because we've had a good experience with following the rules and using common sense.
I have a question
Yes.
for Dr. Traxler about these rapid tests. There are concerns sometimes that these rapid tests give false positives sometimes. Is there any concern about that, or are these tests shown to not offer false positives?
So you are correct that sometimes with the rapid tests there are concerns for those false positive results. However, that is minimized by using them when people are symptomatic, so that the sensitivity and specificity for these when individuals are symptomatic is much higher in the 90%.
And what kind of symptoms are we talking about that children in particular, because we know that kids around each other all the time, teachers, they get colds, runny noses, things like that. So what are the symptoms that they'll have to show in order to get them?
Certainly. So there will be some, such as loss of taste or smell, that are very specific to COVID-19 that alone would be enough to warrant testing. For some of the other symptoms, the runny nose, sore throat, things like that, there might be a requirement for more than one, for you to have, for example, 2 of the symptoms. We have a team, of medical experts looking, and we're looking at that right now in terms of the data for each of these symptoms and putting together the best algorithm for symptoms.
What about headache? Sometimes that's the only symptom.
Correct. And one thing about this virus is it does present very differently in a large variety of ways for a variety of different people. And so we are doing our best to capture and identify as many cases as we can using these tests.
And also for staff, can they get it? And is there any recommendation that maybe they periodically get tested for everyone?
So symptomatic staff who, again, give their consent for the schools will be eligible. And we encourage everyone who's out and about in the community in any way to get tested on a regular basis. Once a month to go and get tested and know their status. So certainly we encourage that, not only of staff in schools, but really any of us out and about.
I've been tested 9 times, and going to be tested some more. And it doesn't hurt. It is quick. It's easy to do, and I encourage everybody to do it, particularly if, before Thanksgiving. Get tested before turkey. It's easy to remember. The tests are available in 99% of the places and instances. It won't cost you a penny. And if it does, just go to the next one. It'll be free, but get it done. Yes, ma'am. Shauna? No?
Well, I actually had an off-topic question.
Okay, well, you want to stick with this?
Yeah, I have a quick question. There are some prominent figures on media who have talked about that people should still have their regular Thanksgivings. And we do know that there is a portion of the population that takes that and plans to still have regular Thanksgiving, that still plans to have family come from out of state or go out of state and then come back. What is your message to people who believe that they should be allowed to have these Thanksgivings the way that they've had them in previous years?
Well, we're not restricting people from having Thanksgiving. We're just I don't know what they're doing in other states. So other states, they're prohibiting all kinds of things. Some states, they shut down manufacturing plants. They've even shut down churches, if you can believe that. But what we're doing is asking everybody to use common sense, to be smart, to get tested before turkey is one thing. But to realize that the virus is out there, it's very dangerous, and we need to be careful. But you can be careful and still have Thanksgiving in the ways that I described.
Governor,
Yes.
Circle back a little bit. The cases are on the rise. Percent positive is on the rise the past couple of days. So, but just by looking at that, it seems like people aren't wearing a mask, or the virus is still spreading rapidly. Do you have any plans to possibly, make changes to keep people accountable to wear their mask, that kind of thing? Any idea that you might have a mask mandate?
No. We're watching very carefully. We're watching what other states are doing. We're getting data. We're getting learning from others' experiences, and we believe that we're doing it the right way. The different locations, of course, have different authorities to do things for their own special situations. It's better than there is no one size fits all in this instance, as has been proven in other cases. We just ask everybody this. We know the virus is there, and we know that it is deadly. And you need to take that into account wherever you go and whatever you do. And we know the effectiveness of masks is not perfect. We know that social distancing is effective. It's not perfect. That you will come into contact, perhaps unwittingly, and everyone in good faith with a surface. But we know all those things, and we know that if you wash your hands, if you're careful, if you stay away, if you feel bad, call the doctor, go home, but get tested. We test all over the state, and in 99% of the cases, they're free. Usually, you give away stuff for free. People will line up, but there's been people are getting tired. There's some reluctance that's involved in this, but it's not gone, and the weather's getting cold. That means we're going to be back closer together. That means we've got to be very careful. If everybody will do that, we'll get through it. I hope the vaccine, or vaccines plural, are here soon, but we have these tests that are available and becoming more available as we go along. So we just have to be smart. Yes.
Are these rapid tests also beyond public schools also going to be available for private schools as well?
What could be available?
Will these rapid tests also be available for private school students and staff and teachers?
What is the program on that?
Certainly. And so, I want to clarify my response to Shauna, too, earlier in terms of looking at the numbers of tests beyond this initial allocation. Part of this and how far tests can go is certainly going to be dependent on what the case counts are, what our rate of flu spread is. So this is even more reason, frankly, to be wearing the masks, getting your flu shot and stuff, so that we aren't having to use as many tests. And at this time, I believe the plan is to go through the Department of Education to the public schools, but we constantly are reevaluating all of our plans, and we'll be seeing how many we continue to receive from the federal government through the end of the calendar year.
And also on DOE, we know when the school year started, some schools did not have a nurse. Do you know what the current count is and what training will be like if schools don't?
So my understanding is that all the schools either have access to a nurse or to another medical professional that can be adequately trained, such as an athletic trainer or the like.
Any more questions?
Yes, Governor. So there is a man scheduled for execution next month, and as you know, we don't have the drugs to go
December the
proceed
4th.
with that. Right. So what do you think of that, and what do you think should happen in terms of planning for that?
Well, I know Director Sterling is attempting to get the drugs that are necessary for executions. As you know, 14 states have what they call the SHIELD law that allows for confidentially, the name of the company that provided the drugs for the execution to a prison system is not revealed. Because what happens, some folks go picket and complain and threaten those companies. And we asked the legislature to provide a mechanism where if the drugs are not available, that it would default back to the other means, and that has not been passed. I hope that we can get the drugs. I hope that Director Sterling is able to get whatever he needs to comply with the law of South Carolina. And when I want the legislature, as soon as they come back, one of the first things they should do is pass that law so that we can implement the law in the state of South Carolina.
I have a question about vaccines and the availability on when we. I think Vice President Pence today said something about some doses of vaccines being available to states for certain categories later in December. Does South Carolina know whether it's going to get any allotment of that, or?
I know the emphasis is going to be first on those that are the most vulnerable, which would be the elderly, particularly people in the nursing homes. Information on that, details?
Sure. So thanks for the question, and thank you, Governor. So to answer that question, Pfizer, which is the first vaccine that could potentially be looking to put in an EUA any day now.
What's an EUA?
It's an emergency use authorization. Sorry. But that vaccination could be available once that EUA is applied for. As far as being able to administer that vaccine, we would have to wait for that EUA, emergency use authorization, to be approved by a group, a body, if you will, to say that it is okay for that vaccine to be used. So it could come really as soon as we could start to receive it, as soon as the EUA is applied for. As far as the application, it's at least 2 weeks for the EUA to be approved.
Did that answer your question?
Sort of. So, I mean, is the expectation that South Carolina, among other states, maybe would get some allotment of the vaccine by the end of the year, at least for a specific group of? Very
limited quantities. We are anticipating getting very limited quantities of both the Pfizer vaccine, and there's another brand of vaccine, the Moderna product, which is a frozen product, and they are, getting close to submit their EUA from what we hear, and so same rules apply, just like it does with the Pfizer vaccine, that we could start receiving vaccines in a pre-position type of situation, but not be able to administer it until the vaccine has been approved through that EUA process.
I gotcha. So there's a space between.
Yes, they can apply, and then there's a review, and then there's approval, and then once they say it's good, then we can begin administering at that point in time. Very limited. Do you have any expectation on when next year, when you think more in the general population would have access to? Yeah, everything that we've heard thus far is that early to mid 2021 we could start to see a ramp up of more vaccine coming. So that's what we know.
Thank you. Any more questions? Let me wish every one of you and everyone watching have a happy Thanksgiving, and we'll see you next time. Thank you.